Good morning, everybody. Thank you all so much for being here the first Monday after a holiday in the morning, especially on such short notice since we just added this session. I'm just going to make sure everyone can get in. Okay. Hey, Anu. So good to see you here. All right. I know that folks will continue to join us, but I would love to go ahead and get started because we only have an hour together, and I'm sure that there's lots that we want to get into. So welcome everybody for the very first session of our series this week called Take Care, Demystifying Insurance and Care Options for Independent Arts and Culture Workers. We are just thrilled to open this unique series this morning with this first workshop, which is called Smart Choices, Making Sense of Employee Benefits. This is the first of 5 sessions that are happening back to back this week. I just popped the link in the chat there if you want to take a look at the lineup for the rest of the week. But we hope that you'll be able to join us for multiple of these sessions. And I'll also note that they are being recorded. We'll get into that in a little bit. My name is Kinsey Keck. I use she, her pronouns. I am a white woman with brown hair. It's pulled back in a bun today. And I'm wearing a very warm and cozy dark green cable knit sweater. And I'm sitting in front of a window with some just like generic white curtains. I'm also the Roundtable's programs director. For those who don't know, the New York City Arts and Education Roundtable is a grassroots service organization that works to improve and advance the state of arts education in New York City and beyond. You can learn more about us at the website that is in the chat as well. Although we are currently meeting online, the Roundtable would like to acknowledge that we do work and live on unceded lands. Mannahatta, or the place also known as New York City, exists on the contemporary and ancestral homelands of the Canarsie, Munsee Lenape, and Wappinger people. These sovereign nations and communities are still thriving here, and we continue to occupy their lands. We would like to give a moment of respect to them, as well as to the Black and immigrant communities, which have helped build the city that we know and love today. As we recognize that all of our pasts, presents, and futures are intertwined, I'm just going to uplift a number of contemporary Indigenous arts organizations in the area that we can all support and learn from. Those links are now in the chat. Please take a moment if you can to save them, explore them later, look into other organizations that you can support and learn from in your area as well. And feel free to share any of those in the chat if you would like to. Alrighty, just a few reminders. If you're having any trouble with Zoom, send me, Kinsey, a private message. I'm here to help. Please keep your mic on mute unless you're the person speaking. We encourage you to use the chat to connect with other folks on the call, but also to share your questions. We will have a little time for Q&A at the end. We'll try to get to everything that you pop in there. This call does include closed captioning, so to activate your captions, you can find either the live transcript button or the show captions button on your toolbar. It might also be in that little more section with the 3 dots. You can find it there and turn those on. And as I said, this session and all the others are being recorded. They will be made available to registrants after this series closes. It'll probably take us a week or 2 to get all of these videos edited and uploaded, but know that as a registrant, you'll receive those links as soon as they are ready so that you can grab any sessions that you missed or revisit any sessions that you want to. And I think that is it for me. Thank you all for bearing with me. It is now my pleasure to turn it over to our facilitator today, Michael Asterino. Michael is an employee benefits expert. He's also the area vice president at Gallagher. Michael, take it away. Thank you for being here.
Thank you for having me. I'm very, very excited to be here. As Kinsey said, my name is Mike Asterino. I'm stoked to be here because a lot of the time that I spend is with very large employer groups across the country. So to be able to be doing something like this is really like one of my passions, something that I really enjoy doing. And we're going to dive right into a bunch of stuff about insurance. Insurance is a very weird, complicated landscape. And to be completely honest, I got into insurance by accident and it's bizarre world. And so one of the things that I really like to do is to spend time talking to people, just making sure that they understand some of the basics here when it comes to something, especially if you are interested in purchasing some sort of plan for yourself, to understand, what am I buying? What are my what are my options? And so we're going to spend a lot of time today talking about just some of the things that are, we consider them basics. I would say that they're basic, but the definitions and these things are just so important when you are making decisions. We're also going to jump into some organizational things as well. I know that there are a lot of people here with a lot of different backgrounds and different ways that you specifically work for organizations. Some, you might put in a couple hours with one organization, a couple hours with another organization. Perhaps you're full-time somewhere, perhaps you're just part-time at 3 different places. So all of those things, need to be taken into account when you are thinking about this insurance stuff. So I think with that, we should start at really the beginning. If you want to jump to the next slide, Kinsey, I just want to take a moment to recognize this sort of framework that that I have here when I think about what it means to be a whole person and a whole employee that comes to work. So I spend a lot of time, like I said, consulting with organizations across the country, and this sort of framework that I have laid out here is something that, yes, our company does, sort of promote this as the way that they think about the world. But it's something that I am pretty passionate about, because I think that it's really important to understand this. And I think that it's not even something that when I start to say, you're going to be like, oh, of course I understand that, because this is my relatable real life experience. So when you look at this sort of diagram here, on the circle on the outside is organizational well-being. And so when I'm consulting with organizations, one of the things we talk about is that in order to have a happy and healthy organization, you need to have happy and healthy employees. Well, when I look at this from more of an individual level, it's really about you and your own well-being as the external circle, right? So what are all the things that sort of encompass me as a person when I'm thinking about, my life? And so we happen to break this down into 3 areas encompassing 4 different things. So when we think about the financial aspect of it, we think about money, right? It's necessary for us to live our lives, and we spend a lot of time thinking about money. Who is going to, be giving us a paycheck, where that paycheck is coming from, how much is going to be in it, and what can I afford? We also spend a lot of time thinking about our career. Where am I going, right? What am I doing? Am I existentially satisfied with the work that I'm doing? And then finally, the physical well-being, which we're going to specifically talk about today with the insurance, and then the emotional well-being, which goes along with the physical, but is also sort of a teaser for some of the sessions that you have coming up later this week. So when I look back at this chart and I think about the whole person, this is the person who shows up at work every day. So when I walked into work this morning, I was thinking about a couple things. I was thinking about, I guess I would put this under, financial, is that, last night at 6 p.m., my mother-in-law said she was sick and couldn't watch my 7-month-old kid. And so the 3.5-year-old has a place to go, but this other one doesn't. So I scrambled to get, coverage for the day. And that's what I walked in. I walked into work, and it was almost a relief that I was here, because both of my kids were now being cared for, right? And I knew that I was going to be able to do this presentation without an interruption. So that also would fall into the career bucket, right? And then from the physical and emotional, I did eat a lot of food this weekend. I'm sure many other people did too. So still feeling some of that, but that's the person that I walked into work as today. And so understanding this framework, I think is really important, because we want to take care of all of these different aspects. And so with the insurance stuff in particular, we're going to sort of drill in on the physical. But while we do that, I don't want these other ideas to sort of fall off the radar. So I just think it's really important to mention them before we get started. So if you want to jump to the next slide, I just want to start with some real basic things about insurance, just as a sort of understanding. Please feel free to put things in the chat. I have the chat over here in my screen so I can see it. Kinsey is also taking a look at it. If you have a question that's more personal, you can feel free to send me a private message in the chat, and we can certainly talk about that. But we'll start with just what is insurance, right? Why are we talking about this? Why is it important? These definitions and some of the things that we're going to talk about today are sort of going to be, I would say, a thread that is followed for the rest of the week. So we wanted to start with something at the beginning. So in its real simple terms, insurance is just the transfer of risk. So if I am buying insurance, all I am doing is I am deciding to pay somebody else or something else for some sort of risk that I may incur. So as an example, let's think about car insurance. I have a car, it's expensive, it costs money if there's damage to the car. I am willing to pay a certain amount each year for car insurance. Let's say that costs a total of $1,000 a year for car insurance. And I'm transferring risk onto the car insurance company so that if I get into a fender bender, fenders today are very expensive. They all have cameras in them. And so that costs $5,000. They are now going to cover that cost because I transferred the risk over to them. So when I am transferring the risk, when I'm deciding to pay them, that is called premium, right? So I'm paying the insurance company for some sort of transfer of risk. The policyholder is me, right? That's the person who owns the policy. That can be different depending on what type of insurance we're talking about, but in this scenario, that's what it is. And then the insurer is the car insurance company. So let's just think Geico, right? We see their commercials all the time. So that is all insurance is. It's just the transfer of risk and the agreement of two parties. One party is going to pay a premium to an insurer, and then there's going to be some sort of policy in place where things will pay according to that policy. So another great example that I put up here is pet insurance. Pet insurance is something that is absolutely exploding in my world. A lot of people really want pet insurance. There are a lot of COVID dogs and cats and parrots and all sorts of animals that people got. And so pet insurance is something that is very easy for employers to be putting in at their company to offer to any employee who works there. So with pet insurance, I have a dog and I am insuring that dog for a certain amount. I'm paying a premium for that dog. And if something happens, let's say he breaks his leg, most likely it would be chasing a squirrel and jumping off my back porch. That would be something that would be covered by the insurer, in this case, ASPCA, and they would agree to pay, my vet bills or something, as outlined in the policy. So that is just a real sort of basic grassroots level of what insurance is. And if we jump to the next slide, we're going to just take that sort of definition of insurance and we're just going to think about it from the framework of health insurance. So when I'm buying health insurance, I'm buying insurance on my health, which is basically things that I need taken care of, right? I need to go to the doctor. I may need to go to a primary care provider. Maybe I need to go to a specialist. Maybe I need to go to urgent care or ER. So when we think about health insurance, there's a couple different things that you're going to see that are just sort of out there in the marketplace. So I wanted to take a couple minutes to talk about what those things are. So the first thing that you will have a type of plan, a type of health insurance plan. Now, I put a couple here. There are other ones as well, but these are just sort of places to start, right? So a PPO plan is simply a preferred provider organization that's basically a plan with in-network coverage, which is doctors who work with your insurance company, and out-of-network coverage. An EPO plan is an exclusive provider organization, very similar, except one of the things that is common with an EPO is that it's only doctors who participate with the insurance company. And we're going to talk about those insurance companies in a second on this slide and what they are. And then an HMO plan is a health maintenance organization, and that the HMO plan is what I would consider to be sort of the smallest network. It's going to be a very small selective group of providers who participate in that. So in a couple slides, we're going to talk about what are some things that you should consider when you are purchasing a plan. Well, one of the things that you will want to consider is what type of plan is it? Can I go to an out-of-network doctor? Can I only go to an in-network provider? Those are, important considerations, which we're going to touch on in a little bit. Now, we also, when we're making this decision to purchase health insurance, we're purchasing from a company, right? So there's a bunch of different companies out there in the landscape. I'm just going to talk about a couple. So the first is the BUCAs, right? So these are the large named companies that if you have worked at an employer in the past who had health insurance or you've had health insurance before, you've probably heard of some of these companies. So the B is for Blue Cross Blue Shield. It could be Anthem Blue Cross Blue Shield. It could be Excellus Blue Cross, right? There's a lot of different owners of that, but there's some sort of blues associated with that. U is going to be for United Healthcare, right? Or Oxford. That's another national carrier. The blues are a national carrier as well. C is for Cigna. Okay, that's another large carrier in the space. And then A is for Aetna. So those are some of the very, very big players. Yes, there's other companies, all throughout the 50 states that provide insurance coverage in those states. It really depends on where you live. But we sort of universally across the country, the BUCAs are usually a player in every state. And then there's also Medicaid coverage, right? So there's Fidelis and Affinity, which are both Medicaid companies. And, we're going to talk just very briefly about Medicaid and about signing up for plans on the marketplace in a little bit. But so that's sort of the who that you're buying. So the what is kind of the type of plan and then how the plan pays, which we're going to talk about on the next slide. Then the who is sort of the insurance company. So if we move forward to the next slide, we're going to talk about some very common terms when it comes to a health insurance plan. So the first one is a deductible. I'm going to be completely honest. I have been in the health insurance world for over 10 years, and the most common question that I get asked is, what is a deductible and what is my deductible? That is a very, very, very common question. So if you're thinking that, or you've thought that in the past, or maybe even you've thought that around car insurance, that is okay. Deductibles are a very confusing thing. Here's how I like to explain it when I'm thinking about what a deductible is. A deductible is the amount of money that you are going to pay before the insurance company starts to pay. So there are some health insurance plans with a $0 deductible, which means that the moment you get the plan, you walk into a doctor's office, you're not going to have to pay full price for anything. There are some plans with a $500 or $1,000 deductible, all the way up to, we could see something as high as an $8,000 deductible for an individual and a $16,000 deductible for a family. The IRS does set limits on, the maximum deductible plan that there is, but it's just the amount of money that you're going to have to pay before the plan pays. So when I think about deductibles, I often think about the car insurance deductible, because that is a little bit of a more common scenario that people see in their life earlier than when they have to think about purchasing health insurance, right? If you start driving when you're 15 in some states or 16, and perhaps you've been in an accident, you've heard of, or you might know a deductible for potentially 10 years before you have to make this decision, upon turning 26 of whether or not you have health insurance. And that 26 decision, just so I'm very clear, has a lot to do with the ACA. And if you are on a family member's plan, your parents' plan, you can no longer be covered after your 26th birthday. So deductible, I get into a car accident. I smash my fender, which I mentioned before is very expensive, and it's going to be $5,000 for me to fix that fender. Well, my car insurance company has a $250 deductible, which means I pay $250 to them, and they pay the rest of that $5,000 bill. So I just simply pay the first $250,000 and then they pay the rest. Well, it's the same in health insurance. If you have a $250 deductible, you are going to pay that $250 the first time that you get service. Could be the first and second time, depending on how expensive the service is that you receive. And then the insurance company plan will start to pay. Now, once that plan starts to pay, co-insurance is the next term that you could hear, which sometimes once that plan starts to pay, it's simply a split of the bill. So it's just you pay some, the insurance company pays some. So let's say that you go to an urgent care and it's $1,000 and you have a $250 deductible. So you pay that, and now there's a $750 bill left for that. Well, perhaps the plan that you have has a 10% co-insurance, which means you pay 10% and the insurance company pays 90%. So in that scenario, you're going to split that last $750. You're going to pay 10%, so you're going to pay $75, and the insurance company is going to pay the rest of that bill. Now, that's co-insurance is a split, right? So you know, it's like you both pay for it. A copay is simply a service, or is simply a set dollar amount that you pay regardless of how much it costs. So a very common example of this is, let's say I go to the emergency room and unfortunately I fell and broke my leg and it cost $5,000. Well, I could have an emergency room copay that is $250, and I would pay that amount whether I walked into the emergency room with a cold or I walked into the emergency room with a broken leg, which I wouldn't be walking into the emergency room with a broken leg. So those three terms, generally speaking, are things that you will also want to consider and think about when you're making this decision of, do I need a plan? Do I want a plan? Am I going to get a plan? And a lot of times we get here and it's like, well, where do I look to find these things? Well, there are two documents that you can look at to understand how a plan is going to work. And this is true for any type of insurance, right? The pet insurance that we talked about, the car insurance, and the health insurance. There's usually something that is a summary. It could be a summary of benefits, could be called a benefit summary. It's available to you when you are making the decision. And there's also a federal document called the SBC, which is Summary of Benefits and Coverage. That document is regulated by the federal government and has certain services listed on it. Summaries can be produced by just the health insurance carrier, and so it can sort of look and feel different. But the SBC, the Summary of Benefits Coverage, which is regulated, is going to look and feel the same no matter who the insurance carrier is. And so understanding where these documents are, if you don't know, you can ask, right? Requesting these documents before you make a decision on if you're going to get health insurance or not. That's really helpful so you understand what's covered, what's not covered, and how it will pay. I'm just looking over at the chat. It doesn't look like there's any specific questions on anything we've discussed so far, so I think we'll jump to the next slide. And this is really just sort of a very large, global question when it comes to insurance. Why would I even want to purchase it, and why do employers even offer it? So the U.S. Surgeon General in 2022 put out an advisory, and it's in bold on this slide. Toxic workplaces are harmful to physical and mental health. Well, I would wager that everybody on this call knows and understands that working in a toxic workplace is harmful to your physical health and mental health. I very often think about my 3.5-year-old who is starting to understand that when he is stressed, that he feels some sort of thing in his body. Maybe it's butterflies in his stomach, maybe he feels, a little bit of something that's happening, and he's starting to really realize that stress and emotions can impact his body. Well, the people on this call who are older, we of course recognize that stress, yes, this impacts my body. Yes, I get nervous on the first day of school or before I give a presentation, or, I feel that in my stomach, or maybe I stress sweat, right? These are all things that I think that we can relate to. Well, I like to bring this back to this idea, this that we talked about at the beginning of, this is me who comes to work every day. I have physical and emotional needs. I have career needs. I have financial needs. And now take that and sort of extrapolate that to my entire organization, whatever organization I'm working to support that day. And that could be different from day to day for a lot of you. For me, I happen to work for one company, but for many people, especially, some of the people who I've talked to in your community, you're working for multiple companies. And so you're going to all of these different places, and there's all of these different things going on that need to be considered. So employers who have over 50 employees in New York State have to offer health insurance to their full-time employees. It's a rule. It's an ACA rule. Now, part-timers and people who work less than 20 hours do not need to be offered that coverage. We're going to talk about, towards the end of this presentation, some ways to, some creative solutions for the organizations that you work with. But holistically, companies need to offer that. And so a lot of companies have taken this tact of offering health insurance coverage that's competitive as part of, almost like as part of pay, so that you can, they can attract and retain employees. Well, that's why a company would offer it, but for many of the people on this call, I think it's a consideration of, should I purchase insurance, period, right? And so there are several things that you're going to want to consider when you're thinking about, should I purchase insurance? And, on the next slide, I'm going to dive into some of those things. And I'm going to actually do this a little bit out of order, only because I as I'm thinking about it and talking about it, I think that it's really the most important thing is really the last one. And I know that you're going to spend some time this week, later this week, on mental health. But really, when you're thinking about making this decision, the first thing that you need to think about is your mentality around it and a peace of mind. What type of person are you, and what type of risk are you willing to take? So you may feel that, I'm young, I'm relatively healthy, I don't think that I want insurance. And that is your choice, right? You can choose not to do that. Now, there are, things that you have to deal with when it comes to the ACA and tax penalties and things like that, but you might be that type of person, right? And that is okay. You also might be the type of person where you say, not only do I want to purchase insurance, I want to purchase the most expensive plan because I just want the peace of mind that if anything happens to me, that it's going to be covered. That is also okay. And I'm simply just here to talk about education and things to consider. I actually couldn't, even if you said, Mike, I really want to purchase insurance from you, I don't, that's not actually how I work or do that. So I just want to call that out. I probably should have said that in the beginning. This is strictly just education, things to consider, things to think about as you sort of navigate this health insurance landscape. So what are you gonna consider, right? What are these things? Well, the first thing, in my opinion, that you really need to do is just ask questions and learn more about the plans that are out there and what you want to buy. I wrote Google is your friend. Google is my friend. And the truth about the insurance world that I will be very honest about is that there's always something to learn. I actually got really fired up when I was talking to Kinsey before this call last week, when we were sort of talking about what we were going to discuss, because I learned something last week that in 10 years of the health insurance space, I just had no idea that this thing sort of existed, and there was this weird sort of loophole in a rule. And I was really excited to be like, you know what? I learned something new. And yes, I may have a lot of experience and, could say, yeah, you're an expert in this, but I think being an expert is just being willing to learn more. So asking questions, talking to people about what's out there, what are your options, those things are really important when you're considering this purchase after you're thinking about my mentality. Next, I would say, regular prescription drugs. So are you taking a prescription medication regularly? That is huge. Prescription medications are one of the largest costs for individuals right now. We could talk about the pharmacy and the pharmacy drug pricing world. We could sort of divert here. We have 28 minutes left, and I could use up all 28 minutes talking about all of that, and it would probably get really boring at some points, but pharmacy is a very broken thing right now, right? The health insurance ACA rules with under 20 hours. I think for some of you, you might also consider that a very broken thing, right? That you're not able to get affordable coverage through your employer. So that is something to consider. Am I taking a regular prescription drug? Now I put RX as a bullet underneath that. You're going to see prescription drugs written as RX on those summaries and those SBCs, right? The summaries, benefits, and coverage. It's important to look for that if you are purchasing a plan, to figure out how much you actually will pay for that type of drug, because you wouldn't ever want to purchase a plan and then realize that it was cheaper for you to just get the medication without the insurance premium added on. Regular doctor's visits. How often are you going to the doctor? So if you have a chronic condition and you're seeing the doctor a lot, you probably also are taking a regular prescription drug. You're going to want to check that summary or the SBC to figure out how much it will cost you if you do purchase the insurance, and will you actually see a savings. I also wrote preventative care, because preventative care, no matter what plan you purchase, is going to be free one time per year to go get your physical. It does not matter if you have a deductible on that plan. It does not matter if there are copays associated with doctor's visits. You are allowed to have one preventative care, sort of checkup with no cost share. What that means is the insurance company will pay for that whole thing. So if you're just going for a preventative visit, it might not be that you need health insurance because you're just going once a year and you're just paying the $200 or $250, however much your physician charges you for that. But preventative care is also important to consider. And then the cost, obviously, this is huge. Is it affordable, right? And what sort of assistance is available? So there are, subsidies when you purchase an individual plan on the marketplace. That's out there depending on your income and how much you earn, on the books. So those are also things to consider when we're thinking about choosing a plan. I think we'll jump to the next slide. There is one question in the chat, but it is a direct message, so I'm probably going to not answer that yet until I read the full thing. I am going to jump back into other insurances that are out there. Now, these additional insurances are just things that exist that I want to call to your attention. Some of the companies that you work for may offer these things, some may not. But these extra insurance coverages are out there, and some companies do make an effort to provide them to their employees. So dental insurance, vision insurance, life insurance, right? And then there's also some, we call these the accident and the hospital indemnity, the critical illness. A lot of times those are benefits that we call voluntary. Think about like an AFLAC, something that would pay you if you get sick. So people will sometimes have a health insurance plan and then an AFLAC accident policy, which if they get in an accident, they would then get some money. There's also disability insurance. There's pet insurance, legal insurance, there's identity theft insurance. There's lots of, ways that you can transfer risk. And so these are just some of the additional benefits that, that are out there that exist. We spent a lot of time talking about health. I wanted to make sure that I included this slide as well. If you want to jump to the next slide, we will just think about this from a holistic perspective of employers and employees working together, right? So you may be on this call as an employer wondering, how can I game plan a solution for people who work, who are part-timers who don't qualify for the benefits that we offer? You may be on this plan as an employee working for one or, several organizations and saying, I'm not eligible for those. What are some things that we can do? So the criteria for coverage is going to be is set by a carrier, but it's really guided by the state and federal law. So if you think about the Blue Crosses and the Uniteds and the Cignas, they say that you have to work a certain amount of hours, but there are minimums that guide that are state and federal law. Now, that legislation, I think, is something that's a little bit outside of the scope of not only my job, but maybe your job, in the sense of that it's not something that we can directly impact today. However, that doesn't mean that we can't be, advocates for that, right? One of the things that I love about this specific community and some of the people who I've met and talked to is that they are willing to be advocates and say, you know what, there are people out there who need health insurance coverage or need insurance coverage through their employers, but don't meet this certain criteria, and, are willing to write to a legislator and say, hey, you should pay attention to this, right? And are willing to stand up for what they see and what they believe in. So that is just something to consider, right? Now, there are creative solutions that are out there. So ICRAs are, individual coverage health reimbursement accounts. An ICRA is something that an employer could set up to give to an employee, and they could give them a certain amount of money each month to go out and pay for their own health insurance coverage on the marketplace. Now, one of the things with an ICRA that is important and that some employers have run into, especially in this space, is if they offer the ICRA, the individual, so think about this as, let's say that I work for, I'll just use my company as an example, right? I work for Gallagher, and Gallagher comes out and says, you know what, Mike, you're not eligible for health insurance coverage through our company because you don't work enough hours, but we're going to give you, some money each month in this ICRA account that you can go purchase a plan on the exchange. Well, one of the things that happens is that you can actually be disqualified for a subsidy on the exchange if you have an ICRA account. So let's say that because of my income that I was eligible for a $400 subsidy as a premium credit to my plan, but the company was actually only going to pay me $200 a month. Well, I definitely want the subsidy because I'm going to be, getting this plan for $200 a month cheaper. That's a much better price point. And so, I'm not going to take the ICRA. So that is something that, is a great conversation for employers and employees to have. But that's one of the things that needs to be taken into consideration. The other thing that is a potential creative solution, sorry, I lost you for a second. One of the things that is a potential creative solution is a cafeteria plan. Now, this is a plan where an employer can put a certain amount of money into the plan for every employee, and they can sort of, use that money for their insurance needs overall. Now, again, you have to be careful of, the subsidies and how that works with the individual marketplace. But these two ideas, this ICRA idea and the cafeteria plan, these are really great conversations and things to sort of bring up and think about as employees and employers are having these conversations. And that is actually my last slide. Now, I did leave some time for question and answer. So if you have a question, I would say throw it in the chat now. That would be a good idea. I'm going to read this direct message to see if I should address this publicly or not. So I'm going to pause for 1 second. Okay, this is actually a really good question, and I don't have to say the person's name, so that's perfect. I am going to answer this question. Um, this person said that they were quoted a high deductible plan, and when they saw the high deductible, one of the questions that they had was, how am I going to rack up that much money to satisfy this deductible, and then also have to pay my premium? So I think I want to talk about this a little bit and see if I can kind of flesh this out. So when you go to the doctor, the provider is sort of allowed to bill for the service whatever they want. Okay, it's kind of like the Wild West. You could go to the doctor and they could say, you know what, you saw me for 10 minutes and I'm going to charge $500. Now, in order for that provider to take insurance, they need to accept a certain rate of reimbursement from the carrier. So let's say that you go see a specialist, a very, let's say asthma, right? That's something that I always, all right, let's say I go to an ENT for asthma, and it's $500 to see them for 15 minutes. They give me all sorts, consultation. They really help me, but they charge $500. Well, Blue Cross might be the health insurance carrier, and Blue Cross might say, you know what, you can charge $500, but we're only going to reimburse you $250 if you're a participating provider. And that provider might say, okay, I'll take that $250 because I want everybody with Blue Cross to come to me, because then I'm going to have 4 times, I can make that money because I'm going to have extra patients, right? So that's how the provider billing sort of situation works. So when you have a large deductible, you are going to be paying full price of the negotiated rate, which is sort of the second number that I said. So let's say that you go to this allergy or this asthma provider and they bill $250. Well, you're going to pay that $250 because you need to satisfy your deductible. Now, let's say that you went and they want you to do a breathing test. The breathing test comes and the bill comes in, it's a $2,000 test. And the insurance company says, well, we're willing to reimburse $1,000 for that. The provider says, okay, we'll charge $1,000, and this person has not met their deductible, so you are now going to pay that $1,000. So basically, you're going to continue to pay full price for the medical services that you receive. When I say full price, I mean full price that the insurance carrier negotiates with the provider up to your deductible amount. So that is how that kind of works. And I want to make sure I answer all parts of this question. So it can feel, as a part-time worker, when you're looking at a high deductible plan, very overwhelming to see that the premium is $500 a month, and then I have to meet a $5,000 deductible on top of that before my insurance starts to pay, right? So if you used up that whole deductible and we're paying $500 a month, it's going to be over 10 grand that you're going to spend in a year on insurance. And so that is the financial aspect that I talked about in one of my slides. That's super important for you to consider, right? To sort of math this out. I know it's not really a verb, but I use it like that. Let's math this out. How much is this going to cost me? The other piece of that is, am I going to go to the doctor a lot? Maybe I did develop asthma and it's really taking over my life and I just need to get this under control. Well, maybe instead of paying $500 a month, I'm willing to pay $1,000 a month for a couple months and get all of these doctor's appointments in with this really good expensive coverage and not pay as much at the provider, right? So I'm willing to pay more premium for a more expensive plan, but then I won't have a deductible. I'll maybe just have a $50 copay every time I go to the doctor. So it could save money that way. So that's another way to sort of think about it and frame it. I hope I answered that question. If I didn't, just definitely respond in the chat. And there's another one that came in too. Let me just read this. Okay. Okay, state mandated coverage up to 25. So this is a good question. So there are here's what I would say about, covering minors when you're thinking about if an employer doesn't cover the family. So there is an option out there. It's called CHIP, CHP, Child Health Plus. Now, CHIP is Medicaid insurance, Medicaid coverage, where you pay based on your income. Okay, so CHIP is available. It's out there, and it's coverage for minors. So let's say that you are on an employer's plan, but they only contribute to the single. Okay, they only contribute to your coverage. They don't contribute to your family. So it's $250 for you a month, but if you put your whole family on the plan, it's over $2,000 a month. Well, a lot of people in that scenario will take the individual coverage for themselves, and then they will go get CHIP coverage for their dependents, okay? Because that is income based for the CHIP coverage, and it provides a lot of services that are out there. So if you Google CHIP or Child Health Plus, CHP or Child Health Plus, that is going to be a good resource for you. There's actually a table that's out there that tells you it's like how many kids do you have, and then what's your monthly income, and it tells you how much you would pay for that coverage. And then CHIP would also, there's going to be like information about signing up and things like that. So that's a really good option to look at. Let's see another question here. Okay. Why is it not possible for the ICHRA to support an employee even if they get a subsidy? So here's the thing about the ICHRA and the subsidy. The ICHRA can disqualify employees from receiving the subsidy. So when the ICHRA is set up, it's going to be important to be looking at, be consulting with an expert, right? Which is typically going to be like a third party administrator who's helping set up the ICHRA, and really seeing if it's going to be with the type of employees that are being covered and how much you're willing to put in the plan, if it's going to be better for the employees to offer that coverage. Because there is a law about receiving the subsidy and also receiving employer-sponsored health benefits, and the ICHRA is going to qualify as an employer-sponsored health benefit because the employer is putting money into the account. And it's going to surround affordability for the plan. And that actually changes from year to year, right? It's based on a couple different things. Affordability is calculated several different ways in accordance with the ACA. So that is one of the things that would need to be considered. So if you had, let's say you worked, it's a great question. Let's say I work for an organization and I'm really interested in, talking to them about setting up an ICHRA. And you know what? I get all of the part-time employees, we sort of band together and we say, you know what, let's talk about the ICHRA thing. Well, that organization is going to have somebody like me, right? They're probably going to have a health insurance broker. And then they're also going to be working with a third party to set up and administer the ICHRA to be able to look at the specific questions around affordability and around, subsidies, such as how many people are on a health insurance plan right now through the marketplace. How much are they receiving in subsidies? Is this ICHRA worth it, right? So that is the affordability concern is really the main concern there. And that's what you're going to have to the organization will have to navigate. That is it for questions that I am seeing. Kinsey, so I will throw it back to you. I will keep watching the chat for the next minute or two in case there's anyone else typing a question, but I will throw it back to you because I know there's a couple other things that you wanted to cover before we wrap up.
Yeah, and folks, if you have a question, you can also feel free to come off of mute. We have some time left, but we can certainly also return some minutes to you if no one has something that comes to mind. Michael, I want to say thank you so much for doing this like really important, I think, foundation setting for the rest of the series. I know we went through a lot of information just now, folks. If you don't have questions now, but some come up later, you'll have many opportunities this week to ask them. Aside from today, we have one session happening every day. Oh, here's a question before I continue. Courtney asked, can we receive the slide deck?
You can receive the slide deck. That Kinsey, you can definitely distribute that. I got two more direct messages while you were doing that. One of them I'm actually going to take offline. So Kinsey, I'm going to email you, and I want you to connect me with this one person. Somebody
Okay.
else did ask about Medicare for part-time workers over 60. I also have a resource for Medicare that is available. So this is a person who works in my agency. They are somebody who actually would sign you up for a Medicare plan if you're over 65. So I will also send that to you, Kinsey. Okay.
Yeah, that'd be great. And then I can share it with everyone because who knows who needs
Absolutely.
it. Okay, great. Yes. So, folks, you will receive a follow-up email. In that follow-up email, you will get the slide deck. I'm sure there will be many other resources from this week, so they'll all be together in one sort of public documents folder, but they will be separated by session. So you will get the deck, you will have recordings and all of that good stuff. I will also constantly be sending you reminders about what is going on this week, so look for those in your inboxes. But I'll also just highlight that tomorrow we will be back again at 10 a.m. from 10 to 11 tomorrow morning for benefits for non-traditional workers, decoding the benefits landscape, and investigating portable benefits. So we will get a little deeper into what your benefits options are. And we're also going to talk about portable benefits, which is not something that exists yet, but that we would love to inform our community about and also get us advocating for it because we think it's a great opportunity. Um, Thank you so much, Michael, for joining us and kicking off this series. I feel like this was a great tone setter for the rest of the week. And thank you all so much for being here on a Monday, especially after a holiday weekend. Much appreciated that you joined us this morning. And we hope that you'll be able to join us throughout the week. Thanks, everyone. You'll have a great day. Thanks, Michael.